All right. Hello, everyone, and thank you for joining today's webinar. My name is Christy Strauss, and I'm the Brokerage Sales Manager at Insurance Advisors Direct. Just a reminder that all lines are muted, so just type any questions you may have in the chat box, and at the close of the webinar, I will read those questions and address them. We are continuing our limited medical series, and today our focus is on the carrier ManhattanLife and be rolling out their plan and what it looks like. As with all the other webinars, today's webinar will be recorded and available on the IAD YouTube website. It takes about 5 to 7 days before it gets uploaded to that website, so give it that. You should find last week's webinar on FlexNet in there as well. I believe there might have been some audio issues last week, so my apologies for that, and hopefully this week is a little better. Now, just to recap, I do want to just go over what Dan Greer went into the past few weeks on the webinars that he facilitated, and it was more conceptually speaking on the sales tips, knowing who to market these products to, some of the things going on with the mandate, along with there's some recent legislation that has been passed that are going to make these limited medical plans even more attractive to consumers. So our whole focus has been in the past few months getting in front of the agents, training you all to feel comfortable when you have consumers or even your clients come to you and ask, hey, what can you do for me? There is no mandate. There's no penalty in 2019. I can't afford these high type of premiums with, catastrophic type plans. I still have a lot of exposure. Is there anything you can do for me? Well, the answer is yes. And as we've mentioned all along, these plans aren't for everyone. You're going to want people with reasonable health, and by that, you're going to want to find out, their prescriptions. If they have a lot of prescriptions, that means they probably have some issues. And, you might want to stay in the same plan that you are now if it's a catastrophic type plan, major medical plan. But that's where IAD comes in. Our job is to educate you and get you prepared, help you with any marketing that you want so that you do feel comfortable and we can help you grow this business as well. Keep in mind, you have those pre-Medicare folks who their spouse is on Medicare and they're not yet. Maybe they're a year, 2 or 3 away from it, and their only option is a major med. If they're in reasonable health, and again, find out, perhaps they want to take a look at a ManhattanLife. So let me go ahead and advance forward and get started. As I said, today's plan is the ManhattanLife plan. It's called Affordable Choice. Now, their plans are considered hospital confinement and fixed indemnity type of plans. Basically what that is they pay the consumer, the policyholder. If the policyholder wants payment to go directly to the healthcare facility or the provider, they can do that. And if there's money of it left after, that additional dollars will then go back to the policyholder. I'll get into the details of really what I'm referring to when I mention that. So here are the selling highlights, just very high level so you can take a look. These are affordable, accessible, and flexible. ManhattanLife has 2 plans. They have a Elite and a Classic. Both are simplified issues, so there are some underwriting questions in a build chart, and both include a discounted network. And just so you know, the networks provided in all these limited medical plans are the same, and it's the multi-plan network, sometimes also referred to as PCHS, I believe. In any event, they're all the same networks. And I went ahead and accessed this and just to see if my physician would partake in this, and my physicians do, as well as the hospitals. They're also in this network. So they have inpatient benefits, hospital admission benefits, surgery, doctor office visits, outpatient emergency urgent care, and there is a lifetime maximum benefit of $2 million for these plans. Just spoke about the networks again. The multi-plan network is the oldest and the largest of all the networks. It is throughout the entire country. You can see they have contracts with over 770,000 practitioners, 5,000 hospitals, and other ancillary facilities. There's an average saving with these pre-negotiated rates of 20 to 30% on in and outpatient. And if you just wanted to look at that network, you could go online to the www.multiplan.com, and you'll be able to drill down and just check in to see if your physician is part of it. They also have a built-in RX eDo, and that is sort of a discounted pharmacy program. The savings runs about 65%. I did go online using this website address, defindlowrx.com, and all the Meijer stores participate in this. So when you have this plan, you can go into the Meijer pharmacy or some of the other stores in your area, and they'll partake in it. So that's a pretty large discount. It's free to use, and there's over 10,000 medications. And the way it works is you go ahead and get your prescription filled, then you submit that bill to the carrier, and they will reimburse you $25 for a given prescription. We'll get into the details here. The first plan I'm going to just reference here is the Elite plan. And the Elite plan here is inpatient confinement. Now, the Elite is the better, the richer of the two plans. Inpatient confinement is a $3,000 inpatient per day amount that will be given. Now, I'm not sure if you can read down here. It's a little blurry here, but it's a 200,000 calendar year limit. So it's not a daily limit like the FlexNet. This is a calendar year. So ambulatory surgical, you're going to have, if the surgery is performed in an ambulatory or outpatient facility, the benefits payable include surgical and anesthesia, in addition to the per day inpatient confinement. Just so you know, that's not really clear on there. So my apologies for that. Hospital admission, you're going to get $2,000 for the first inpatient day each calendar year, and then the $3,000 thereafter. Emergency room visits, they're going to give you up to $250 a day. There is a limit of one of those per calendar year. Then the surgery benefits. The daily surgical benefits for both in and outpatient, maximum benefit of $50,000 per calendar year. So just know that that's how they do their surgery. It pays, assistant surgeon and anesthesiologist pays a daily amount for the surgery. And if you scroll on down, and I'm not sure you can see it very, very clearly, the daily amount's going to vary by state, and it's going to be in the outline of coverage. So I don't have it on this screenshot, but I can send you more information after this webinar. Now then, for doctor office visits, it's a $75 per day, and there are 4 of those days per calendar year. So let's just say, for example, your physician charges $50 a day for a physical, or $50 for that physical, and this is using the network with negotiated rates. Then you would get a check for $25 because they're allowing $75. Now, if you choose a doctor that's not participating in that too, that's not a problem. But let's just say, for instance, their fee is $100 a day. Then you would get paid the $75, and you would then owe an additional $25 on that. So that's really how it works as far as payment. The outpatient medical benefits, there's a preventative section right here. It's a $300 for a colonoscopy, $100 for a pap smear, and $100 for a PSA. I will tell you, my husband had prostate cancer, and so he still has to go for twice a year PSA checkups. And I looked at a recent bill, and we have Blue Cross and Blue Shield through his employer, and the bill was $62. So let's just say this is a pretty generous amount for this particular test and preventative. So just something to keep in mind. Laboratory test services, there's $100 per day for surgical pathology and $50 a day for other laboratory tests. There for radiology services over here in this far bullet point is $500 for an MRI, $250 for a PET scan, and $150 for a mammogram. Now the maximum per calendar year is $2,000 for all of these different services. So it would be easy to stay within this this confine right here. So then, as I mentioned earlier, the prescription drug plan is not really a plan, it's more of a discount offering. Is a $25 a day for both plans, and that is a $750 calendar year maximum. So perhaps you go to the physician's office, maybe you've got an infection and they give you some kind of penicillin or amoxicillin. Perhaps that is a generic drug, and it may be $10. So throughout the year you might have, let's just say, a couple of $100 worth of prescription drugs that you end up taking. So you're under that calendar year maximum, but you're going to get reimbursed each time you use it for $25. The ambulance is ground and air. It's $1,000 per day, and there's $100 per day for ground transportation. There's a limit of 2 of those per calendar year. And then that lifetime maximum amount is $2 million. That was the Elite. Now this is the Classic plan. So the Elite was the richer. The Classic isn't as rich. It's a $2,000 per day inpatient versus the 3. Instead of $200,000 a year, this one is $100,000 a year. Everything's the same in the language of the ambulatory surgical benefit, and the hospital admission is $1,000 for the first day, and then thereafter it follows that $2,000 per day. The emergency room is the same. It's $125 per day, limit of 1 per calendar year, and then it is the same for the surgery benefit of $50,000 per calendar year maximum. It also, on the schedule of benefits, will pay assistant surgeon and anesthesiologist based on your state and what's embedded in that schedule of benefits. And then the doctor office visit is a little less. It's $50 per day here, and it's three visits per calendar year instead of 4. So the laboratory tests are the same, $100 and $25 per day for other lab tests. Radiology is going to be a little bit less. It's $250 for an MRI instead of the $500, $250 for the PET scan, which that's the same, and $100 for a mammogram instead of the $150. What you don't see in here on the Classic are the preventative amounts. It doesn't have the preventative colonoscopy, pap smear, or PSA. So that, a few of the differences on the plans. The prescription drug plan is going to remain exactly the same with that $25 benefit, allowing that much for each prescription up to $750 in the calendar year. Also, the ground and air and ambulance are going to be the same as the Elite, $1,000, and then $100 for the ground. It allows those 2 per calendar year, and then it's a $2 million lifetime maximum for the plan. So here's an example of the monthly premiums. You can see the Classic and Elite. Hopefully it's clear enough for you. It's for an individual between the ages of 18 and 29, $87 or $110. Let's look at those pre-Medicare aged folks that are in reasonable good health. And you can see for an individual, it's $164 or $207. You've got the individual and spouse, individual and child, individual and family, and then you have, let me get rid of that. Then you have the child only in this particular amount. The child only, it remains constant. It's the same premium no matter what category. So I'm guessing what they're saying is if you're in this age bracket and you have one child that you're adding, or just that you're in that age bracket and your child needs health care, that's why they sectioned it out, but it's the same premium. Child is under the age of 18. So just keep that in mind. And I did have an agent that just wrote a child only standalone. Also had another agent write a couple of kids going off to college. The nice thing about the applications is you can forward date the effective date. So if you write it now while they're at home, then, when they start college on, September 1st, they're good to go. So here's, this screen shows some examples of just a few scenarios, how this works. And you can see here, based on this Elite plan, the description and the cost of that particular event that took place. The adjustment with the network discount is going to leave a balance of $22,913. Then when you add in what the Affordable Choice Plan pays, it will show you, based on that particular event, that the total paid was $23,000. So in this particular scenario, the policyholder is getting back a check for 87 some odd change dollars. Now you'll take a look at a broken arm, and what does that look like with the emergency room and follow-up visits. And keep in mind, they're not always going to follow exactly something like this, but this is more an example. They factor in the multi-plan network discounts, and you can see the Elite plan pays $925. Your balance is going to be $863 by the time you factor in all these other costs. Routine preventative care exam with labs. You can see what that looks like. And this is the Affordable Choice Classic, not the Elite, so it's not the richer of the plans. Your balance in this particular plan is going to be $55. So a little bit different than our major medical plans where you have to pay out of that deductible or pay until you reach that deductible. These you get to right away. Now, most of you on the call are probably in Michigan, but just know that this plan is pretty much nationwide. There are a few states that has not been filed, and a few states were waiting on approval. But it is a robust plan, much like the FlexNet in many of the states. And I would imagine that this is going to grow over the next few years. Let's take a look at some of the frequently asked questions. So if you had a question in your head, this might go ahead and address it. What is hospital indemnity? Well, as you probably all know this, it's a plan that provides fixed benefits regardless of the actual cost. It doesn't coordinate with any other health plan. So basically, because it's indemnity, it does pay the policyholder, or that in this circumstance, policyholder can have it directed to the provider. Is this major medical? No, it is not. And no sense in even telling your clients it is. It's a fixed benefit plan. And that's probably a better name than limited medical, which sounds kind of scary. Fixed benefit sounds a little bit more technical and like, yeah, that makes sense. But it's not a major med. It's a flat amount listed on a schedule, and there's no deductible. It can be used as a supplement. Because it's an indemnity plan, you can stack these all day long. There is no enrollment period. You can apply or enroll into one of these plans year-round. Why do I want this if I have a major med? Well, you know, I'm not sure that you would. Manhattan actually has something called, it's like an out-of-pocket plan or a gap plan. So if you have somebody that does complain to you about their exposure, then perhaps you'd want to look at something like that. It's very affordable. I can send you information on it. A few of these limited medical carriers, like IHC, Philadelphia, and Manhattan, they all offer these types of plans. Again, very affordable and meant to help with that exposure for people who have major medical plans that they can afford the premiums, but they're really just concerned about that exposure. But anyway, they are high deductible plans. You can be exposed to thousands of dollars a year and other costs such as missing work and child care and unforeseen expenses. Are the medical questions, oh goodness, no, let me move this over. Let me see. To answer for enrolling this, yes, there are some underwriting questions, as I mentioned, as well as a build chart that somebody will have to fit. It's a pretty liberal build chart. And is there a waiting period? No, everything is covered from day one with the exception of pre-existing conditions, and there is a 12-month on many of those pre-X's. So, you know, once they've owned the policy for 12 months and they have an illness or one of their pre-X's occurs, then it will be covered. And is there a network I must use? Well, the multi-plan network is pre-negotiated for discounted rates, not required to use, but it would make great sense to use it. Like I said, you'd be surprised at how many doctors are actually partaking in this plan. How long is the claims process? And it's typically 7 to 10 days. So just, you know, I'm sure your clients are going to be asking about that. Can I use this plan if I'm retired? Well, if you're retired but you're not 65, then yes, you certainly can. Once you turn 65, this is no longer going to be the plan for you. This addressed the pre-existing conditions again. There is that 12-month wait period. Does it cover doctor office visits? And, you know, I did go over that. Yes, both plans have a different amount. And what about the prescription drugs? As I explained, it's a discount plan, $25 for each script. If your script is $50, you're still only getting $25. You're going to need to send that into the carrier for that reimbursement check. It doesn't pay the pharmacy directly. There is no military discount, unfortunately, and generally this does not cover pregnancy, but however, the complications due to the pregnancy it would cover. So by that I mean if you've got a scheduled C-section, it's not going to cover that. But if you're going in and something happened and you had to have a C-section, it's going to cover that. It will cover the newborns the first 31 days, and you will be expected to then add them on as a child to your plan. And outpatient visits, this does cover those outpatient visits and pays for some of the lab and radiology testing. But the Elite plan does have preventative services baked right into their plan. And as I've been referring to, are benefits paid to the provider or me. The policyholder receives the claim benefits unless otherwise assigned by the policyholder. So again, the control is in the hands of the policyholder for this. And there is a surgery benefit. Again, the maximum is $50,000 per calendar year. If I'm admitted into the emergency room and discharged within, I'm guessing that says 24 hours, I'm sorry, or if I go in as an outpatient, will this plan cover me? You must be admitted in for 24 hours to receive inpatient benefits. Otherwise, it is just an emergency room visit. And then what happens if you're admitted into the hospital? How much will they pay toward the daily room charges? And the Elite plan is $2,000. That's for the first day, and then it goes to $3,000. $2,000 for, oh my goodness, I'm sorry about that. It is $2,000 per day on the classic plan, and it's going to pay the first $1,000 on that one. So these are just a few of the frequently asked questions. Like many carriers, Manhattan does have a sales incentive trip. So, reach certain levels and you can travel to some of the destinations that they provide each and every year. As I mentioned at the beginning of the webinar, our focus the past few months has been really staying in front of agents to let them know that there are going to be consumers and your clients that are going to start asking questions about this, because you sell health insurance, and even if your focus is mainly seniors, you're going to get asked. And if your focus is mainly seniors, don't discount your pre-Medicare seniors because this will also work for them. So our job is to make certain that you're comfortable, that you get marketing pieces that you would like, and feel free. We have open lines to both Dan and I. We're sort of the lead on this particular product. Dan's really expertise lies in with Philadelphia American. He works very closely with that plan. He probably knows it inside and out. I've been working closer with Manhattan and FlexNet, but between Dan and I, we can answer all of your questions on any of these carriers. So with that being said, I am going to just check and see what kind of questions we have. And if you had a question, you can go ahead and write it in the chat box and I will address it. So I'll give you a minute to do that. And if you don't, then I'm going to thank you for joining today. As I mentioned, this will be in the IAD YouTube library within 5 to 7 days, as are the other past video or webinars that we have facilitated on the Limited Medical. We'll be chatting with you, calling you, making sure that we stay in front of you. But again, feel free to let us know if you should have any questions. So with that being said, I want to thank you all for your time today, and you all have a very good day.